All right, so if you suspect a G6PD deficiency in your patient, what sort of test should you do? You should do a glucose 6-phosphate dehydrogenase assay. People with uh, an aortic test velocity greater than or equal to 4.0 meters per second should get what sort of surgical prosthesis? They should get an aortic valve replacement. How long does it take for the tick to transmit Lyme disease? 36 hours. A diverticular bleed is usually due to what? Eroded small arteries of the colon. Acute dysentery suspicion needs to be confirmed with what sort of test? A stool culture and Shiga toxin, right? True or false? Carpal tunnel syndrome is due to medial nerve compression. That's true. It's the medial nerve that's compressed with carpal tunnel syndrome. In obvious cases, you will need to contact the state medical board to report a physician or surgeon or a healthcare professional that's acting outside the bounds of proper medical activities, right? Is systemic lupus erythematous associated with neuropsychiatric issues? Yep, yep, it is. What is travelers associated diarrhea typically due to? E. coli. For a kid that pees the bed, if they're greater than or equal to 5 years old, what sort of medication and lifestyle, or basically what should be done? So if they're older than 5, do a UA, get an enuresis alarm and some lifestyle changes, like don't drink a whole bunch of water before bed. Maybe even consider desmopressin and some sort of implementation of a reward system. For a confidence interval to be significant, what cannot happen? Right, it cannot overlap. The likelihood of type 1 errors is increased when testing for multiple secondary endpoints, FYI. What sort of crisis are patients with sickle cell disease at risk for? Acute sickle hepatic crisis, right? If you see a patient and they have a red scaly rash which appears to be clearing from its center and they have endocrine issues, what sort of medication, sorry, not medication, but what sort of issue do you suspect? Starts with a G, ends with oma. You should suspect a glucagonoma. The most effective female contraceptive methods are IUDs and subdermal implants. Patients with crampy abdominal pain after meals should get a workup for what? Chronic mesenteric ischemia, and they should also get abdominal imaging. If you have a patient with a stroke, do they need to be evaluated for bleeding risk? Definitely evaluate them for bleeding risk. Patients with stroke need evaluation of what major parts of their bodies? Their heart and their neck for the most part, as well as their head, but yeah. Lateral shoulder pain in someone that moves their arm a lot is likely due to what? Rotator cuff tendonitis. What condition often presents as hypertension and hypokalemia? Hyperaldosteronism. A pancreatic pseudocyst should be suspected in a patient with abdominal pain, tenderness, and elevated levels of what? Lipase for sure, and also, amylase, 3 times normal. If you suspect, neonatal polycythemia, uh, what hematocrit are you looking at? A hematocrit greater than 65%, and that would be in a term infant. And at that point, you should recheck the hematocrit from the peripheral blood. And if the patient has neonatal polycythemia, how do you treat? Treat with a partial exchange transfusion. A patient with suspected Paget's should have a head X-ray, and a serum calcium and phosphate. What sense anomaly is frequently seen in person with Paget's disease of the bone? Hearing loss, right? What female medications increase the risk of hepatic adenomas? Oral contraceptives, right? If you suspect anemia in a patient with end-stage renal disease, what stores should be checked? The iron stores. SSRIs can be used to treat depression in patients with Parkinson's disease, FYI. Patients with cervical insufficiency should get a cerclage placement in order to do what? To decrease the risk of preterm delivery. Note that you want to measure an anti-tissue transglutaminase antibody in patients with concerns for celiac disease. What sort of biochemistry issue is pernicious anemia due to? It's due to anti-intrinsic factor antibodies. Pernicious anemia is due to anti-intrinsic factor antibodies. And note that there is absent rugae in the fundus of patients with pernicious anemia. What sort of lymphoma is untreated celiac disease associated with? It's associated with T-cell lymphoma, which typically arises where? In the jejunum. What is the first step in treating hyperosmolar hyperglycemic states? It's volume resuscitation. If you suspect renovascular hypertension, what's some of the first imaging things that you would do? You should do an MR angiography of the renal arteries if you suspect renovascular hypertension. Obviously, if you want to speak to the patient, speak to them if they're with family or friends or whoever in there and you want to preserve confidentiality, maybe speak to them alone. That's obvious. And another thing that's obvious is if the suspected abuser's in the room, you want to separate the patient from their abuser and speak to them alone. And sometimes ask patients for their rationale if need be. Why are studies blinded? To keep observer bias in check. SSRIs should be trialed for how long? For 6 weeks. SSRIs should be trialed for 6 weeks.